Hello and welcome to this short presentation on using medicines effectively. This is the Acute Headache Rescue Plan. This is part of the Severe Headache Expert series. My name is Raeburn Forbes. I'm a practicing neurologist and I help look after people with problem headaches and give advice to family doctors on how to manage their patients with headache. An acute headache rescue plan is a plan of action for a disabling headache episode. If you have a plan of action and put it into place, it will help you stay in control. It will also avoid the discomfort of trying to get advice out of hours or waiting around doctors' offices or emergency rooms. You'll probably know already that some medicines do seem to work well and others do not. Even the medicines that work well, however, have a problem. There's a tendency that after a period of time, the headache returns and then will persist. Rather than giving up at that point, I think you should try and consider a headache episode as a period of time where you undertake active headache management. And this is where the Acute Headache Rescue Plan comes in. With the help of your pharmacist or family doctor, choose a medicine. Then you use it. It's important that you don't wait for your head to become very tender before you take a medicine for headache, because if your head has become sensitized like that, the painkiller is unlikely to work. Once you've used a medicine for a headache, you need to decide whether you think it does work, and it may take a couple of headaches before you realise if that is the case. If a drug works, you need to get a supply of it and then use it the next time. You also need to know that distractions will help. This includes things like taking a short nap, going for a walk, listening to some music, or listening to relaxation tapes. An acute headache rescue plan is therefore a series of steps taken over 24 hours. Here's step 1. You probably want to take a simple painkiller and an anti-sickness tablet together, or if you know already from previous experience that they are ineffective, you go for one of the triptan drugs. If you have used one of the triptan drugs, you can repeat these at 2 to 4 hours. At 6 to 8 hours you can take yet another simple painkiller with anti-sickness medicine. If you get beyond 8 hours or get towards the time of your normal bedtime, inducing sleep can be helpful, and diazepam is a widely used drug that might help with this. The following day or after sleep, you may still have a lingering headache, in which case you want to take another painkiller and anti-sickness tablet. You must remember that in all these steps, non-drug distractions such as sleep, listening to music, going for a walk are very helpful. Additional amounts of paracetamol can be taken. You should always try and avoid codeine containing medicines though. Here's a sample headache rescue plan. You can use this template for your own headache rescue plan, and I would strongly recommend that you do this. What you have here then is a series of steps that you follow to try and get you through the bad day with the bad headache. This approach, however, will require some prescriptions at some point, but other than that, you should feel in full control of what you're doing. Remember, you must get the foundation right. Your lifestyle must be a headache-friendly lifestyle, and you must not overuse painkillers. The Acute Headache Rescue Plan is a targeted plan of action that you'd hopefully require no more than about 10 times per month. Remember that distractions are helpful and that inducing sleep is also helpful. Think of a headache as a period of time of active headache management that you undertake yourself. So what can you do? I think you should create your own acute headache rescue plan, and if you get a plan, stick to it and remember the non-drug options, which are really distractions. The next videos in the series will look at drug-free treatments, including physiotherapy, vitamins or herbal treatments, and biofeedback. If you want more information, you can sign up to a monthly newsletter at the Severe Headache Expert website. There are frequent postings on Google+, Facebook, and more videos will appear on the YouTube channel.